So take your baseline financial plan and you're really just memorializing the client goals, right? Quite literally all on the same digital page. But then when I get to the healthcare planning section, right, this is where I say, hey, look, like this data that's being drawn in, like this is, you go on genworth.com's calculator or whatever, and you put in the cost of long-term care, or you look up the IRMA bracket and you put in the healthcare premiums. I'm like, this is baseline stuff, right?
Yep.
Just like with anything you do, next step is to move over to the specialist and take a look. Now, Move Health's platform, just to answer Lisa's question again very directly, Move Health's platform does have a nice estimator to give you an idea of what the cost would be pre and post 65, right? Depending upon, household count, what state they're in, all those fun things, and their income. That's just an estimator. So when you have a team in place, they make it really easy. You type in client information, takes like 2.5 minutes, right? And then you click send referral email. A referral email is then sent to the client, or you can elect not to send it if you don't want to, like whatever works for the client. And then you have access to a calendar link. You go on that calendar link, you put joint time on, you type in your email, your phone number, client email, client phone number, and boom, you are scheduled to meet with someone who is actually going to take a look at their overall financial picture and give them guidance and advice. And I would say that for me, the biggest part of the membership has been MoveHealth's already been paid, right? So you now have transformed what is the traditional broker or transactional relationship into this is the healthcare advisor, right? This is the health insurance advisor. They're going to look through the overall picture and provide some feedback. And they're now sitting there on the same side of the table as the client saying, hey, we're going to give you really thoughtful advice. If you want to go implement it elsewhere, I mean, that's your choice. 99% of people, unless you live in Rhode Island, because Rhode Island's a pain, are going to say, "Hey, like, do the application for me. Like, let's move this forward." Right.
Yeah.
The value of working with a partner like Move Health, or I would say Move Health specifically, is you've got a human, you've got an advisor, you've got a person. They're giving you information and guidance. It is actionable, it is organized, and it is good. Right. I can't think of a better way to handle the healthcare conversation. And honestly, most of the time, I'm just sitting there in the background, hopping on the call, taking notes so I learn more for myself.